Hello and welcome to our fourth video in Chapter 1. In this video we'll be considering four major ideas: anatomical position, directional terms, body regions, and finally planes and sections. In considering anatomical position, we need to envision a patient or subject standing in a particular way so we have a good reference point. If we want to discuss a term as being above or below, in front of or behind another, we need to have a standard from which we're referring, and we would call that standard anatomical position. In a standard anatomical position configuration, the body is standing upright, the feet are very slightly apart, the palms are facing forward, the thumbs are pointing away from the body, and we always refer to any body part compared to any other as being in standard anatomical position. It's important to note as you look at this particular position that left and right refer to the individual or the patient being observed, not those of the observer. Think about facing somebody who's looking at you. Your right is their left. So keep that in mind as you consider anatomical parts over the next few months together. This individual who's showing up on screen right about now is standing in standard anatomical position. Notice that they're facing you, their feet are slightly apart, the palms are facing forward, arms are down, and the thumbs are off to the side. With that in mind, let's discuss a few directional terms and orientations. The first is, and these will all be presented in pairs, or most of them will be presented in pairs. The first pair of terms we'll look at is superior and inferior. These are also known as cranial and caudal. Look at the top one first. Superior is toward the head or above another structure. In the example here, the head is superior to the abdomen. In another example, your knee would be superior to your ankle. Next, the next item visible here is inferior or caudal, and this refers to being toward the lower part of the body, and generally is referred to compare two terms. The navel is inferior to the chin. In standard anatomical position, the wrist is inferior to the shoulder. Imagine holding your arm over your head, and I would ask you, in fact, take just a moment, put your right arm up over your head, and now ask yourself, is your right wrist superior or inferior to your shoulder? If you thought superior, then stop and think about it. No, we always refer to those body parts as they would be in standard anatomical position. Our next pair is ventral and dorsal, also known as anterior and posterior. Ventral means toward the front of the body. The breastbone is anterior to the spine. Dorsal means toward the back of the body. The heart is posterior to the breastbone. The way I always keep dorsal straight in my own mind is to think of a dolphin. Where's the dorsal fin on a dolphin? The dorsal fin is on the back. Now, that raises an interesting issue. And the issue is that humans are a little different than many other animals in the world. We stood up, and when we stood up, we twisted kind of all of the references on this page around. Ventral and anterior are synonymous in humans, but it's not the case in four-legged animals. Anterior means toward the front in us, and best way to think of that is to bring two individuals on the screen. Let's look at a human, and let's consider a cat, in this case a mountain lion. Looking at the cat, where is its back? The back would be dorsal, and that is not the same as its posterior. Its posterior end is where its tail is. So its dorsal surface is its back, its posterior surface is its back, legs, and tail. For us, dorsal and posterior are the same. Where's the belly on the cat? Got it? Okay, where's the belly on the human? For us, ventral and anterior are the same. Not necessarily the same on the cat. So it's worth being aware that when we stood up, we twisted pretty much all four items on this page around a little bit. Turning a page, We'll take a look at the next set of directional terms. The first is medial. Medial means toward the midline. And again, this is often used to refer to two different body parts. The heart is medial to the arm. Your nipple is medial to your shoulder. The next example here is lateral. It means away from the midline or away from another body part moving toward the midline. Your arms are lateral to your chest. Your nipple would be lateral to your sternum. The next is intermediate, which means between two structures. The collar is intermediate between the breastbone and the shoulder, for example. And all three of those terms relate to each other. Medial and lateral and intermediate. I would ask you to kind of think of these as structures on a map. Is Temple, Texas, north or south? Well, that really doesn't make any sense. Is it north or south of something? Compared to Waco, Temple would be south. Compared to Austin, Temple would be north. So any body part could be described as medial, lateral, or intermediate to any other. You just have to choose the appropriate reference point. Again, go back to your nipple. Is it medial or lateral? Well, it's medial to your shoulder, but it's lateral to your sternum, your breastbone. Turn the page again. The third set we'll take a look at, we're going to start with another pair. That pair we'll look at is proximal and distal. Proximal means closer to the origin of attachment of a body part to the trunk, and distal means farther away. A great way to think of this is often used in reference to something like an arm or a leg. Your arm attaches to your torso at your shoulder. So I would ask you to think of your elbow. Is your elbow proximal or distal to your shoulder? Well, it's farther away, so we're getting distal. Your elbow would be proximal to your wrist. In other words, it's closer to the point of attachment than your wrist would be. The knee is distal to the thigh, the elbow is proximal to the wrist, and so on. So the next group we'll take a look at is superficial and deep. Superficial means closer to the surface. Deep means deeper, farther away from the surface. Your lungs are deep to the skin. The skin is superficial to muscles. The muscles would be what to bones? Think of the arm. You've got bones very deep inside, then a layer of muscles on top of that, then a layer of skin on top of that. So your muscles would be superficial to your bones, but your muscles would be deep to your skin. Turn the page. Next, we'll take a look at regional terms. There are two main regions of the body we need to talk about. The axial portion of your body is effectively your trunk and your head and your neck. The next major division of the body is the appendicular. Think of your appendages. What are your appendages? Those are your arms and your legs, your limbs. Regional terms help us to discuss particular areas of the body. And as we look at the next page, we'll see some of the major regions of the body. Let's start at the head and work our way down toward the feet. Actually, what I'm going to do is I'm going to work my way down the left side of this page and then down the right side. Cephalic refers to head. In the cephalic region, we have frontal, that's the forehead. Orbital, that's the eye socket. Nasal, of course, is the nose. Oral is the mouth. Mental might be a little confusing for you. Mental is actually the anatomical term that describes the chin. Cervical means neck. In the chest area, which is orange in this picture, we see sternal right over the breastbone, axillary, which is an odd word which means underarms, and mammary, which means the chest area, the middle part of the chest, whether you're looking at males or females. Move down to the purple area where we have the abdominal area. In the very center of that, there would be the umbilical area right around your navel. Below that area, we get to the pelvic area. The inguinal area would be the groin. The pubic area contains the genitals proper. Now, coming down the right side of the page, we start with the upper limb. Now, you're tempted, I know, to call everything from your shoulder down to your wrist your arm, but that's actually not anatomically correct. The point of the shoulder would be the acromial portion of the body. The area between your shoulder and your elbow is your arm proper, and that part's described as the brachial area. The inside bend of the elbow is the antecubital area, And your forearm from your elbow to your wrist is your antebrachial area, or your forearm. So your arm is actually from your shoulder to your elbow, and your forearm is from your elbow to your wrist. Speaking of the wrist, that area is known as the carpal area. The entire hand is known as the manus, and the manus contains several distinct regions. The thumb is called the pollex. The palmar area is, of course, the palm of your hand, and your fingers are your digits. Now, moving on to the lower limb, we get to the thigh, which would be the femoral region. Sorry, I skipped the coxal region, which is the hip. The knee, seen from the front, would be the patellar area. As we move below the knee, we get into the leg proper, and that's the crural area. Off on the side, by the little toe, we have the fibular area, sometimes called the peroneal area. As we move into the foot, we get to the tarsal area, which is the ankle, the metatarsal, which would be the bridge of your foot, the toes, which would be the digits, and the big toe proper is the hallux. Now turn the page and let's look at this individual from behind. A lot of these areas are the same, but there are some subtle differences. We still have an upper limb with a brachial and antebrachial area. The elbow from the back is a little different. That was the antecubital area from the front. It's the olecranon or olecranon area from the back. The hand doesn't change much. We still have carpals and digits. The palm of the hand would be the metacarpal area. Coming on down into the lower limb, we see the femoral area, which is the thigh. Now, the knee is different from the back. It's the popliteal area seen from the back, not the patellar region. The back part of the lower leg is the sural area, or the calf. The foot is still the pedal area. The heel is calcaneal, and the lower surface of the foot, the part that you stand on, is the plantar surface. Plantar is an interesting word. In fact, there's a kind of wart you can get that a lot of people misunderstand. You may have heard from Grandma or Great Aunt Betty or somebody like that who talked about Uncle Fred having plantar's warts, and some people think, well, that's because he walked outside barefoot at the farm. It's not plantar's warts, it's plantar warts. So the plantar surface of the body is the lower foot. Coming back up to the top, let's walk our way down the right side of these labels. The head is still the cephalic. The otic region refers to anything to do with the ear. The occipital is the back of the head. Cervical is still the neck. The back surface, seen here in blue, is the dorsal surface, and it has several areas. By the shoulder blade, we have scapular. Running right down the middle of the back, we've got vertebral, which is an association, of course, with the vertebrae. The right and left side, just off the middle in the low back, would be the lumbar area. And the little diamond or triangle shape between the butt cheeks, forgive me, there is the sacral area. The butt cheeks themselves would be the gluteal area. As we come down and center, we get to the perineal area that's between the anus and the external genitalia, and that will finish off this particular picture. Let's turn to the next page, where we'll be seeing an idea of anatomical variability. Humans differ both inside and outside. And here's the place where I get to tell you that over the next few months, I'm going to lie to you about, roughly 10% of the time, because humans do vary. About 90% of the structures we'll go over will match what you see in the textbook and what you'll see in people and potentially your future patients. 10% of the time, individuals will vary. Nerves and blood vessels may be out of place. You can, in some cases, even see entire organs that are completely reversed. Some small muscles may be missing, and there are variabilities that are fairly typical. Extreme variations, though, are not consistent with life, and if we have some extreme variabilities, they may actually result in an individual that does not survive well. Next, we'll talk about body planes and sections. A plane is any flat surface that we can cut the body into anatomically and make observations. A section, on the other hand, is a cut or a section made along a body plane. And we'll see some examples over the next few pages. First, body planes. There are three most common ways to divide a body so we can examine it. They're at right angles to each other, and the first we'll take a look at is the sagittal plane. The next we'll consider will be the frontal plane, sometimes called a coronal, and then finally a transverse or horizontal plane. We'll discuss sagittal first and then move on to the next. In sagittal plane, we're dividing the body part vertically into right and left parts. Imagine a blade coming down from the ceiling and cutting you into two even right and left halves. This produces a sagittal section when the body's cut on that way, and if it's cut right down the middle, we would describe that particular cut as a mid-sagittal plane. It divides the body into two even right and left sides. A parasagittal plane is off the midline and divides the body into uneven right and left parts. If we were to completely cut off my right arm, for example, we've got an extreme parasagittal cut that divided me into a right arm and then the rest of me. Frontal planes divide the body into front and back portions. If we were to slice off an individual's face, and you'll see that in some of the anatomical structures we'll look at, then we would produce a frontal or coronal cut. The last major body plane we'll consider is known as a transverse or horizontal plane, and it divides the body into upper and lower parts. If we were to cut an individual at the waist, so their upper part and lower part were separate, we would have a transverse plane. On the next page, we'll see an individual who is divided in these three ways. The first we're going to consider is a frontal section. That's the one that we see pointed at here. This would divide an individual into front and back parts, and we're looking at the frontal plane, and in this particular image in the lower left corner, we can see a image showing the lungs on the inside, two shoulders, liver, heart, stomach, and that would be an image that we would see taken in frontal section. Next, we'll look at the lady's cut that goes across her belly, the transverse plane. And if we make a cut in this way, in this particular case we're seeing an MRI image that's been colorized, we can see down into the top of this lady's abdomen. Last and finally, we'll look at the median or mid-sagittal cut. In this particular image, we see the rectum, we see the vertebrae along the back, we see intestines up in the front. That's going to do it for this video. Thank you for your time. See you soon.